Welcome to the Quebec Academy of Aesthetic Medicine in Montreal. Today, we are looking at the mechanics of long-term structural tissue enhancement.
You're a licensed medical professional in Quebec. You already know your way around a syringe, and you inject hyaluronic acid fillers regularly. But today, patient requests are fundamentally shifting. The demand for immediate, localized plumping is giving way to a desire for gradual, natural, and long-lasting tissue improvement across the entire face. To meet that growing demand, you need products that act as true biologic catalysts, specifically advanced biostimulators like Sculptra and Radiesse. Comparing these treatments, HA fillers on the left instantly occupy a physical void. On the right, biostimulators trigger localized collagen neogenesis, instructing the body to build structural proteins over months. But the catch? Biostimulators are non-reversible. They are there to stay. When a product is unforgiving and takes months to show results, trial and error isn't an option.
AMEQ Academy in Montreal recognized this educational gap, completely rebuilding how advanced aesthetic techniques are taught. Instead, they use a flipped clinic model. This approach deliberately separates the cognitive study from the physical execution. By requiring you master the underlying science independently before you ever step foot in the building, the entire clinical day is freed up for what actually matters: holding the syringe. This masterclass is built specifically for licensed physicians and nurses in Quebec who already possess foundational, hands-on experience with dermal injectables. We bypass foundational injection mechanics and basic anatomy. Participants arrive with a working knowledge of hyaluronic acid delivery. Medico-aesthetic care carries strict regulatory requirements. The curriculum aligns with provincial frameworks, ensuring professionals expand their skill sets within existing legal boundaries. Because basic competency is assumed, the training moves directly into reconstitution, precise dilution ratios, and complex treatment zone technique. Treating biostimulators like standard fillers lead to severe complications. Applying traditional injection logic to a collagen-stimulating agent is ineffective and clinically risky. Safe integration of these products requires an entirely distinct procedural framework. The first of our 3 core modules focuses entirely on advanced cannula technique. Delivering biostimulators safely relies on cannula mastery. Precise movement through these planes reduces trauma and bruising, particularly in highly complex areas like the temple and jawline. The mechanical precision developed here carries over into your standard filler treatments, raising the safety profile of all your daily injectable work. Because biostimulators require wide distribution, flawless mechanical precision is the only barrier between successful collagen integration and severe vascular compromise. The second module examines Sculptra, focusing exclusively on poly-L-lactic acid protocols. Here we see rigid, porous poly-L-lactic acid particles dispersing into a fluid matrix. Over time, they prompt surrounding fibroblast cells to weave new fibrous connections. Practitioners must master exact reconstitution protocols. This infographic breaks down the precise water-to-product dilution mathematics needed to achieve specific suspension viscosities. That ratio is dynamically altered based on the treatment zone, with different viscosity values required for the temples, cheeks, and jawline. We analyze strict patient selection criteria, identifying candidates who are biologically suited for this treatment and rejecting those who are not is a necessary clinical skill. We cover the specific steps necessary to prevent delayed onset nodules and granulomas, alongside the protocols for early management if they occur. Practitioners must also manage the physiological gap between the injection appointment and the visible outcome, setting accurate timelines during the initial consultation. Administering poly-L-lactic acid means managing a delayed biochemical timeline. Strict adherence to exact dilution and placement protocols is the ultimate safeguard for the patient outcome. The final clinical module details Radiesse, examining the mechanics of calcium hydroxylapatite. This visualization shows the product's dual mechanism. In stage 1, particles stack to form a rigid structure scaffold for immediate volumization. In stage 2, the scaffold slowly breaks down, while prompting new cellular growth in its place. We contrast its structural volumization against combining it strategically with hyaluronic acid. We also introduce hyperdilute preparations. By altering concentration, the dense scaffold diffuses into a thinner, wider network, covering a larger surface area. This hyperdilute approach targets diffuse skin quality, texture, and laxity improvement, rather than localized structural projection. Navigating this wider distribution requires mapping specific vascular anatomy and learning complication management protocols unique to this preparation. Proficiency in hyperdilute calcium hydroxylapatite establishes a clinical capability, diffuse skin quality improvement, that standard fillers cannot achieve. The hands-on day features 4 participants, working through a full day of clinical exposure on 4 live patients, utilizing authentic products, culminating in a certificate. Providing authentic Sculptra and Radiesse guarantees realistic exposure, while the strict 4:4 ratio ensures extensive hands-on time. The limit of 4 participants is the structural centerpiece of the program. Every individual injects, receives immediate correction, and builds muscle memory. A large group observation setting simply cannot replicate that feedback loop. By the end of the day, you have translated your textbook understanding into ingrained physical muscle memory. This entire progression is built to align strictly with the aesthetic practice frameworks mandated by the AMEQ for physicians and the OIIQ for nurses in Quebec. And when you return to your own clinic to integrate these products, AMEQ provides a post-course safety net, offering direct guidance on clinical questions and complication management. Fluency in biostimulators allows you to offer patients the long-lasting, structural results they are actually asking for. It is the definitive capability gap separating standard injectors from advanced aesthetic practices. Stop relying on observation to build your clinical skills. Secure your place in the next 4-person cohort at AMEQ Academy. Contact AMEQ directly. Call 514-574-4636.